Thank you, Chairman Schweikert. I now recognize the gentlewoman from Alabama, Oversight Ranking Member Terri Sewell, for her opening statement.
I'd like to thank the chairs and ranking member for today's hearing, and of course a special thank you to all of our witnesses who are here today. As this committee hears testimony on Medicare Advantage program, we cannot forget that just a few weeks ago, House Republicans voted for the largest cut to health care in our nation's history. Because of Trump and congressional Republicans, 17 million Americans will be kicked off of their health care. More than 300 rural hospitals will be at risk of closing, and half of our nation's nursing homes will have to cut staff in order to keep their doors open. My constituents deserve access to quality, affordable health care, whether they live in Birmingham, Alabama, or the rural Black Belt. However, Trump's cuts to Medicaid will leave over 219,000 Alabamians without the care that they deserve and need. Moreover, the Alabamians that do not lose their health insurance will face rising costs and decreased coverage. Despite efforts from Democrats on this committee, Republicans voted against the advanced premium tax credit, which made it possible for millions to be able to afford their own health care plans. Today, while we focus on ways to improve Medicare Advantage program, we cannot focus on effective reforms and solutions without accounting for the chaos and upheaval our nation's health system will face because of Trump's big ugly bill. As a representative from areas both rural and urban underserved areas, maintaining access to hospitals for my constituents is a matter of life and death. It is out of this concern that I urge this committee to protect hospital access by strengthening the financial stability of health systems serving Medicare beneficiaries through legislative reform. Americans, especially our seniors, need reliable, affordable health care coverage. Currently, over 54% of Medicare beneficiaries are enrolled in Medicare Advantage programs. Additionally, we are spending about 20% more per beneficiary on Medicare Advantage compared to traditional Medicare. With its increasing popularity, Medicare Advantage plans present a great opportunity for this committee to introduce legislative reform. As ranking member of Oversight, I agree that we must examine troubling practices in Medicare Advantage program, which have created financial nightmares for health systems and providers across this country. Many health systems and providers have continued to voice concerns regarding abuse of prior authorization, denial rates that are sky high, payment delays, overpayment in programs, increased administrative burdens, and a lack of transparency, to name a few. Another significant concern is the lack of oversight within Medicare Advantage. In 2024, Medicare spent $83 billion on rebates for supplemental benefits, representing more money than Medicare spent on the entire physician fee schedule. Yet this committee does not have any systemic records or data on supplemental benefits cost or utilization. There is simply no information regarding how often or not enrollees use these benefits. We must work to first improve the transparency within Medicare Advantage to gain access into the true nature of the problem this committee needs to resolve. It is clear, given the number of beneficiaries choosing Medicare Advantage plans, the program is here to stay, and when done accurately, will give direct benefits. So we must ensure that the program is not limiting access to health care in our most vulnerable communities. I look forward to the hearing and to hearing from our witnesses about Medicare Advantage and what we can do to reform it in order for it to meet the promise that it brought when it was first implemented. I think it's really important that we focus especially on the denial rates, and I have to tell you, I'm quite concerned that AI will only exacerbate that. And so I think that now is a great time for us to work together, Republicans and Democrats, to actually make Medicare Advantage meet its promise. Thanks, and I yield back the balance of my time.